Kunal,
Yes,
please
Ashok Shinde.
stick
Yes,
to your time, please.
yes, yes.
Right?
First of all, I would like to thank the AIOS for this wonderful opportunity to present me, and it's my fortune that I have learned from Dr. Mansi ma'am from Vivekananda here in Dehradun itself. So my talk for today is this innovative approach in surgical training. So why it is we need the innovative approach? First thing that we have a lot of MS seats and lot of DNB seats, and for a one fellowship seat there is a 30 applications. So surgical training is really difficult in nowadays, and we need a good institutes and good trainers for this purpose. So it is to be done how? What is the innovative way to done it? How? So I compare always. I tell my students, now I am a consultant at HMIS and I teach them. So it is learning like a bicycle. How we learn a bicycle? You can see the observation, preparation, and experimentation. All this cognitive learning behavior. So what is in observation? In observation, the old one is to have the microscope, and students are standing out there and they are watching, but it is nothing, we can see nothing. So the latest is that you need a recording system, you need a monitor, and that then you can display it. So what to observe? By trainee, he has to observe how the surgeon is doing the surgery, how is his critical thinking, and how he holds his instruments, not in a microscope, but in a real way. And what trainer has to see in a trainee, that how the trainee is dealing with the cases, what is his logical thinking procedure when he is doing that, and how he just deals with the stress in the surgery. So it's the observation is this very important. It requires a communications and difficulties. So next is this preparation. Preparation is both a mental way and a physical and a mental. It deals with the skills and knowledge. Knowledge domain. You you have to make the concepts clear. And how you make it concept clear? By diagrams, like how to make a cystotome, or how to make a rhexis, or how to chop. Then is the analog story. Means ki for a phaco, I used to tell a student how to make a chop. So it's like holding an onion and then you cut it. You cannot cut on your hands. So when you hold your phaco piece, you have to chop it lateral to it. So it's the analog story that they remember a lifelong, and they tell me कि हाँ sir आपने बताया था तो काफी अभी remember हुआ. So concepts should be very clear when you are telling, and it's a teacher's jobs to make them interesting. Then resources, there are a lot of resources, textbooks. Now there are online resources, videos, and it goes on. 1 minute videos. I have my YouTube channel that clears the concept in 1 minute. So this is the cognitive domain, and the psychomotor domain that deals with the old way was the wet labs, but the recent one we have at the Orbis is the visually augment VR rooms. So VR equipments are really helpful in this way. This is the latest innovative approaches. Then now the experimentation. Third phase is the experimentation. For the experimentation, you need there should be two domains. Administrative level, that the teaching institute should have a mindset that the peoples are learning, students are learning, and they require a lot of time, so OT may run out of time. So that one mindset they should have, and they should they should have the ability to retain the teachers with the good pay. But what the unfortunate story is that good teachers are leaving the institutes because of this administration level. Then at the trainer and trainee level, they should let the trainees do the cases and observe him in details and give them dedicated time. Then there is the failure. Every surgeon must have failed. So failure is the part and parcel of learning, but don't get panic, and don't shout on the complications. Handle the complications calmly and discuss the case, the way of handling such complications, and then video review keeps apart. Then frustration is a part of both the every trainer goes through the frustration. There is a phase of frustration, but it's a teacher's job to make him better. So it's to be a mentor at that time, and he has to both monitor and mentor him. And then the next step is a recovery. In recovery, I say the people that live in the present, because present is a gift. Then it's a repetition cycle. It's a whole the cycle is getting repeated, and you need a breakthrough. That is a luck. So mastery. So in my conclusion, I said that you can achieve anything if you are calm at a peace with yourself. So it's learning is always a heart, head, and hand. So I call it triple H, a cognitive domain where is a head. You should have concepts cleared. Then affirmative domain, heart, that you should be receiving, you should be valuing, and you should be accepting your mistakes. And then a psychomotor. Then comes the hand, where you called it psychomotor, the reflex movement and this. So I always say surgery is done by the mind and then by the hands. So these are my ways of innovative teaching. So I presented in a non-formal way. It was not a PowerPoint. So thank you all.
Yes, Dr. Kunal, very nice presentation. And you covered, you actually emphasized on all the three domains. And now the things it is actually for having a 360-degree development. Basically, one should look for that. And you have focused on that very nicely. And this is true like for all the trainers, all the ophthalmologists or those who are in teaching or otherwise practicing, training residents. They should actually have this passion.
Yes.
Passion is what required actually for training.
Yes.
That is an essential thing.
And it's my luck that I trained here under Dr. Mansi ma'am and came here.